السلام عليكم. بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين نبينا محمد وعلى آله وصحبه أجمعين. Professor Al-Arfi, thank you for this nice introduction. This is the first style of introduction I've had over the years. As Professor Al-Arfi said, I'm going to take you over a journey over the years to tell you where we have started with osteoporosis in the Kingdom of Saudi Arabia and where we are right now. I have to start by saying that osteoporosis is an old disease. It is not like something like COVID-19 or something that was only recognized recently. And in this very nice study that was done on the mummies, they took the skeletons of the old ancient Egyptians. You know, these ancient Egyptians were buried in two types of cemeteries. Cemeteries for the VIP, royalties, and so on, and for the workers. And when they did DICS scans on these skeletons, they found that osteoporosis appeared to be more common in females and appeared to be more common in the VIP people, I suppose because of the style of their lifestyle, the sedentary lifestyle that these people have been having over this time. This is just to emphasize the importance of osteoporosis and osteoporotic fractures. As you can see here, you look at the osteoporotic fractures in comparison with other diseases in women, such as breast cancer, stroke, heart attack, and so on. You will find the magnitude of disease related to osteoporotic fractures is much more important, with all different types of fractures, hip, wrist, vertebral, and so on. So we are dealing here with a very important disease and very old disease. And this slide just emphasizes the importance of the impact of hip fractures in people who sustain this type of fracture. You can see that 80% of them would be unable to carry out at least one independent activity of daily living, 40% unable to walk, permanent disability in 30%, and even death within 1 year. And despite all of these things, the medical community recognition of osteoporosis and osteoporotic fractures came rather late. And as a matter of fact, these are some of the earlier societies that have recognized osteoporosis and established their own osteoporosis societies. Osteoporosis Canada, 1982. In the States, the Bone Health and Osteoporosis Foundation, 1984. The Royal Osteoporosis Society in the UK, 1986. The Swedish, 1987, and Australian and New Zealand Osteoporosis Society, 1988. And while the International Diabetes Federation was established in 1950, the IOF was established in only 1989, many years after the International Diabetes Federation was formed. So the medical recognition of osteoporosis came late compared to other diseases. Now, these are some of the medical societies that were formed in Saudi Arabia and established. The earliest one, perhaps, is the Saudi Heart Association, 1987, the Gastroenterology Association, 1988, and the Saudi Thoracic Society, 2002. So these are some of the societies that have established their own, societies that they have been established earlier than the Saudi Osteoporosis Society. So it was felt by different people and groups from different specialties, including endocrinology, orthopedics, rheumatology, nuclear medicine, and so on, to establish the Saudi Osteoporosis Society. Now, at that time, there was a difficulty to establish a scientific kind of society. And I remember at that time, we found that the only way we can establish the society is through the Ministry of Labor and Social Affairs. And this is why the name of the society is Al-Jam'iyya Al-Saudiyya Al-Khayriyya Liwahan Al-Idham. And the founder of this society was the late Dr. Muhammad Mufti. And that was in 2002, and the headquarters of this society was in the Security Forces Hospital. And this society was fairly active, and this is a very important event that took place during that time of that society is the first certification densitometry course in 2005 was held. And it is interesting that it was done in collaboration with the Pan-Arab Osteoporosis Society and the ISCD. And Dr. Alia Khan from Canada was invited to be the guest speaker in this important course. And this is a Riyadh newspaper. You know, at that time there was no Twitter and there was no these things that we have, Tawassul Ijtimai. So the only mean of telling the community and the society that something is going on is through newspapers. And interestingly, I found this in the Sharq al-Awsat newspaper, and this is a lecture that was given by Dr. Muhammad al-Shakir. You could see how young and handsome he used to look. He still looks handsome with the white beard and so on. And it says, أولى محاضرات الجمعية الخيرية قوة العظام عناصرها وأهميتها السريرية in Radisson Sass Hotel. And so I think there was an interest to inform the society that this الجمعية الخيرية was having important activities at that time. Professor Dessouky was the main founder of the Saudi Osteoporosis Society in the year 2005, and this was a society that was formed under the umbrella of King Saud University. And I always tell people that if there is somebody who has devoted his life to the subject of osteoporosis, it would be this person, Professor Dessouky. We are all practicing and taking care of all the, but nothing compared to Professor Dessouky's efforts in that regard. He even was able to publish a nuclear medicine newsletter, and most of the issues that were published at that time were related to the subject of osteoporosis. And very early in 1991, we were able to get a single photon absorptiometry device. And this is a very simple and beautiful device. It's probably that big. The patient has to put his forearm in the device, and according to the attenuation or the absorption by the bones, the gamma radiation is absorbed through the bones. And this is the first quantitative method to know the bone mineral density in these people. And this was the earliest, perhaps, publication in the area of the epidemiology of osteoporosis. I guess that at that point of time, the main people were just interested to know, first of all, what is the epidemiology of osteoporosis in Saudi Arabia. And these are some of the earlier observations that were made in that paper. The DEXA scan came in 1987, and Professor Dessouky published a very important paper. This paper, by the way, was quoted by people all the time. In fact, we used to call it the 40, 30, and 20 paper. And in this paper, which is a hospital-based after all, Professor Dessouky found that 40% of the women that were scanned had normal bone mineral density, 33% with osteopenia, and 24% osteoporosis. So we used to tell people when we go to conferences, you know, we have 40% normal, 30% osteopenia, 20% osteoporosis. And this was a very important earlier paper in the field of epidemiology of osteoporosis. But perhaps the most important study, there are many studies that were published, including some of mine, but probably nothing compared to this important study that was done by Professor Al-Ardawi from King Abdulaziz University in Jeddah. And it was done through enrollment of patients from health centers in different parts of Jeddah. And interestingly, he was able to compare the manufacturer reference data with the Saudi reference data in terms of the epidemiology of osteoporosis in men and women. And you could see that the rate or the prevalence is reasonably high. The economic burden of osteoporosis in Saudi Arabia, there are 3 or 4 important publications in this regard. Here, it's the overall incidence assessed by Dr. Sadat and his group in people 55 years or older had a direct cost of 564 million riyals. So we are talking about huge impact of this disease in terms of cost. This is a paper that was done in the Journal of Medical Economy, and you can see also huge cost of fractures, mainly hip fractures. This is a paper that came from our university, Dr. Balkhi, Professor Munafoda, and the group. And it tells you that the direct medical cost of patients is about $1,000 US, and those with osteoporotic fractures, the total direct cost would rise to about $10,000, of which 56% is attributed to the surgical procedure. And certainly with the aging population of the kingdom, it is anticipated that the rate of fractures in our community would increase, and that certainly would increase the cost. Now, we and our colleagues in the society had two ultimate dreams that we were just dreaming that we would like to establish in Saudi Arabia, mainly establishing guidelines for the management and diagnosis of osteoporosis. And later, when FRAX was introduced, we were dreaming of having our own Saudi FRAX, compared with the earlier countries that established their own FRAX rates. And indeed, this is a very important landmark study that was done by Dr. Yusuf Al-Saleh and the group. And these were the first guidelines that were published in the year 2015 on the diagnosis and treatment of osteoporosis. And this paper has attracted a lot of attention and was cited quite often by other expertise and journals. Now, between 2014 and 2018, we collaborated with the Ministry of Health for producing two important documents. The first document was the Clinical Practice Guideline on the role of vitamin D, calcium, and exercise in fracture prevention in the elderly. And at that time in the Ministry of Health, and I don't know whether this department exists, there used to be a department called the Saudi Center for Evidence-Based Healthcare. And I remember when we went to the hotel, having our meeting with a working group from McMaster University, I found other colleagues from cardiology, and I don't remember, maybe nephrology, and asked them, what are you doing? They said, we are also making guidelines in some areas of our specialty. So that department was indeed very active, and they were able to produce important guidelines. And I'm not sure if these guidelines have reached to the medical community in the way we like or not. But perhaps more importantly was this national plan for osteoporosis prevention and management in the Kingdom of Saudi Arabia, 2018. And this is a very important document, as a matter of fact. And a panel of members from the Saudi Osteoporosis Association met with people from the Ministry of Health, and we had two international advisors at that time, Professor David Kindler and Professor Alia Khan. And over a period of 2, I think, or 3 days, we were able to establish very important plan for the management of Saudi Arabia at the level of the kingdom, including, for example, creating materials and programs for the community, focusing on public knowledge, train and educate medical trainees, update local guidelines, in state national level mandatory BMD reporting, certification courses, develop or improve existing assessment tools, establish fracture liaison services, generate credible disease data and real-world evidence of osteoporosis, ensure broader alignment of the KPIs in alignment with the 2030 vision, ensure necessary long-term research and knowledge transfer in collaboration with other sectors such as CACs, universities, and so on. This was a very important, and when we were telling people about this, they were so impressed, they wished that these important action plans were published in medical journals. Now, the updated guidelines to appear hopefully this year have been submitted to the medical journal, and hopefully they are under publication, and they will hopefully appear very soon. This is a very important also guideline on the diagnosis and management of osteoporosis in postmenopausal women in the Gulf area. So that, again, was a very important document that also was produced in collaboration with the Osteoporosis Society in the Gulf countries. At the level of the society, we had so far including this conference, six conferences since the year 2012. Strangely, all of them were held in this hotel. Except this, the one to the left, this is the conference that was held in Jeddah. You can see Professor McClung and McCloskey and all these people. This is the second conference. You can see Mr. Parathyroid, Professor Bilzikian in the picture, Professor Rizzoli, and Beth Dawson-Hughes. So we had some very successful conferences that were devoted to the subject of osteoporosis, vitamin D deficiency, and so on. The densitometry courses, we had at least two, and syllabus with all the instructions. These syllabuses were distributed to the audience. International lecturers were brought from outside, and the latest one, we had even a course for the technologists or the technicians and another one for the physicians. The World Osteoporosis Day is certainly a very important day that we celebrate on the 20th of October every year. We've had over the years maybe 7 or 8 in the different parts of the kingdom. And certainly in terms of the public awareness, we have had activities made for the public. This is one in Mall Al-Arab in Jeddah, which was organized by Dr. Salwa Al-Aidarous. And this is the participation from the audience in these public awareness campaigns, the brochures that were distributed. And then we came to the area of FRAX, and FRAX was certainly a very important tool to know the 10-year probability of fracture in patients with osteoporosis. And by the time we were working on establishing our own FRAX, many countries have already preceded and established their own country-specific FRAX rates. And of course, as you know, the FRAX depends on the application of all of these clinical risk factors in producing this important tool. And it is said that if the 10-year hip fracture risk is over 30 and a 10-year osteoporotic fracture, major osteoporotic fracture is more than 20, there would be an indication to, and we were using this tool all the time. It took us a long time, maybe a number of years, to establish our own FRAX, because Saudi Arabia is a big country and we had to have the hip fracture incidence rates in the different parts of the kingdom. And we had to put all these data and submit them to the WHO center in Sheffield. And it was a very difficult task. Dr. Yusuf Al-Saleh was the head of the group in this regard with members of the Saudi Osteoporosis Society. And as a matter of fact, indeed, we produced this important document in which we found that there were 2 Gulf countries that preceded us, Abu Dhabi and Kuwait, in this regard. And we found that our fracture rates were comparable. But by contrast, the probability of a major fracture or hip from the age of 70 were much lower, and it was presumed that that would be related to the mortality rates in our country compared to these 2 Gulf countries. And the Saudi FRAX was finally established in October of 2021. The vitamin D correction guidelines was a very important. Every time we have a presentation in an osteoporosis conference, people ask us about vitamin D. They don't ask anything related to the lecture. They ask about vitamin D, how much and how and when and all these things. And these guidelines were produced for correction of vitamin D, and the document came out in 2017, and I think doctors in Saudi Arabia are using these guidelines to tell them the doses that they have to use for the treatment of osteoporosis. Now, lastly, the fracture liaison service in Saudi Arabia was a very important area that we needed to explore as well. And again, countries have established this service because of very important reason. And the reason is that a fracture at any skeletal site will double the chance of future fracture. And this is the phenomenon which has been labeled as fracture cascade, as you can see. And the secondary fracture often happens within 6 to 8 months. So perhaps if you have no excuse for catching the first fracture in the patient, the establishing of this service will allow you to capture the second fracture and not to miss it, so as to prevent its occurrence, a phenomenon which has been labeled as capture the fracture. So the whole purpose of this program is to prevent any future fractures. And the majority of individuals who sustained fragility fractures were noted to have received little management in terms of prevention of further fractures, treating them with calcium, vitamin D, and specific drugs to improve the status of the bones. To date, more than 800 FLS programs across 52 countries were established. The basics of the program are very simple indeed, but it needs a lot of cooperation from different sectors in the hospital. You need a champion with identification of patients with a recent fracture, diagnostic workup, treatment, and follow-up. It is not so complicated, but the implementation in a certain hospital requires the engagement of the stakeholder people. So the administration has to be involved. Other important departments, particularly the orthopedic department, has to be involved and has to give us full cooperation in this regard. And to really indicate the gap that we are having in this regard after people have had fractures, at least 2 or 3 papers have focused and concentrated in this area, all reflecting the fact that people, after they have a fracture, receive very little attention in terms of prevention of any future fractures. This is a paper by Professor Munafoda and another one by Dr. Yusuf. They are all indicating the fact that very few patients received osteoporosis-specific therapy, for example, and the mortality was 23.5% 1 year after the fracture has been sustained by these people. This is another paper by Professor Sadat, also in this regard, indicating the importance of this gap that needs to be closed through the FLS program. And different colors of stars have been designed to indicate the level at which the FLS program has reached in a specific hospital and country. And you can see that in Saudi Arabia, we had 2 FLS workshops, one in the year 2018 and one in the year 2021. And in Saudi Arabia, a few hospitals, maybe, I hope this is up to date, having the blue color and the bronze in form. As you can see that as the best practice FLS program advances, you go from blue, bronze, silver, and gold. And from my humble experience and observation, I noted that the smaller the hospital, the easier to have an FLS program, because people know each other, the departments are in harmony, and it's not very difficult. Also private hospitals, because it gives them a little bit of propaganda that they were able to establish. It is surprising that small hospitals in remote countries were able to reach the gold standard very easily. So really, at the end of my journey over the years regarding the service of osteoporosis in the Kingdom of Saudi Arabia, these are some thoughts that I have made. It's an important and major public health that needs to have important attention. Some progress has certainly been made in collaboration with other sectors and societies and the Ministry of Health. Surveillance studies on hip fractures were made and the FRAX tool was established. These are areas that need more improvement, fracture liaison services, more osteoporosis public awareness campaign, more utilization of the guidelines, and more cooperation with other sectors. And when we looked at the action plan that was produced in 2018, I put in red the areas that were established or the areas that were improved, including the ones like creating materials and programs, the guidelines, and all of these things. Some areas are still in yellow, and these are the areas that need to have more attention and to be given more weight. Like, for example, the alignment to produce the KPIs, and these are very important because these reflect basically to the medical community the efforts of the society in terms of its efforts to prevent, diagnose, and treat osteoporosis. So after this short journey that I took you over the years, I think that perhaps we can safely land and finish the trip. Thank you so much.